want to welcome everybody to a special edition of the Salt Therapies Association, Salt Ed, and hope everybody is safe and healthy wherever you are. I know for a lot of people today, there's some facilities that are opening. Everybody's in a different perspective in terms of what they're dealing with. And as you know, for the last few weeks and since this pandemic started, we really got to a place where we are able to, start really looking at some things. And as I see, Dr. Penn just joined us. So, hi, Doctor. How you doing?
Good, Leo.
Good. Well, welcome. I know you have some limited time, so I really appreciate you jumping in. We just started the call. We have over 200 people that have joined the web class from all over the country and some all over the world. So I appreciate you taking some time out of your day. For those of you who don't know Dr. Penn, I'll let him say a little bit more, but a little bit of the backstory is one of the facility members in the Nebraska area, Gene Cardell, who's a panelist on the call, who also is in the salt therapy business, has some mutual relationships. And that's when Dr. Penn actually reached out to Gene about some of the salt therapy work that was going on and began some dialoguing. He's an infectious disease doctor, and he's in Omaha, Nebraska area. Actually was involved with citing one of the first cases of COVID-19 in his state. And he and I have been talking over the last couple of weeks really about how halotherapy can maybe be making an impact, both with the rehabilitation and recovery of COVID-19, but also possibly in the preventative aspects of it. So, Dr. Penn, I just want to really welcome you onto the call and all. And first off, I just want to give, hope everyone is healthy and safe where you are and with the clinic and at the university. I'd love for you to kind of give a little bit of your background and share your kind of road to how you got here and what some of the things that you're working on. So please.
Well, thanks, Leo. I'm a board certified infectious disease specialist and internist. My training was primarily at Creighton University. When Christine Sanders, they came from the Jacksonville, Florida area and came to Omaha, and I was an internist, had been practicing a year at the hospital I'm back at, Methodist. They recruited me to come and do some work in what's called bacterial interference, where I did all these throat cultures on families with twins and could document that the normal strep in the throat could interfere with group A strep infection. Then we lost our interest to antibiotics at that point in time. And now my interest has come back to what's called the microbiome and that hidden organ. And they recruited me to come back in the early 80s. And since then I've directed what's called the Department of Epidemiology and Infection Prevention here at Methodist Hospital. We're in the building I'm in now. We have our infection prevention staff for the whole Nebraska Methodist health system and direct a number of nurses. As you mentioned, we saw the first patient in Nebraska, which created quite an alarm. And since then, we now have over 8,000 patients, which is a relatively small number worldwide, I know, with about 90 deaths. And we're experiencing a surge at this point in time. In just the last week or two, our numbers are significantly increasing in terms of admissions. My interest is centered around the microbiome, that hidden organ. In fact, and I mentioned to you now, it's available on my website. I can get you the links on Facebook. Sure. It's a 2-hour lecture I gave for our Methodist College concerning what's called the lung microbiome. That, as with the general microbiome that we discovered 10 to 12 years ago, we only discovered the lung microbiome 5 years ago. And much this work is done in the University of Michigan and out on the East Coast. And what we've learned is that lung microbiome is probably what determines if you're staying healthy or if you get COVID-19, are you going to have complications, including ending up on the ventilator are you going to survive or not? And I think we're just still scratching away at understanding all that. In ways we're in the solar system trying to get to Omaha. We're going to get to Omaha, yes, eventually we will. But I think the importance, as this relates to halotherapy, we know the normal lung microbiome relates to your oral microbiome, oral pharyngeal microbiome, and whatever's going in the upper respiratory tract is going to in part determine your lung microbiome. So if you get sinus infection, if you have underlying chronic respiratory infections in the upper respiratory tract, you end up with bacteria that should not be there, like Haemophilus and Moraxella, Strep pneumoniae, and it goes back to this so-called lung microbiome. There's 3 determinants as we go through in this lecture series. Is you've got migration of bacteria, and we're all constantly inhaling in bacteria, and we go through those numbers, and we're also constantly microaspirating, especially when we sleep soundly. So you've got immigration or migration, then you've got elimination, all these normal protective mechanisms that clear the microorganisms through the mucociliary apparatus and so on, and trying to prevent things from getting down in those 600 million alveoli, those alveoli that about the diameter of your hair, and that protective mechanism of elimination. And then there's the regional growth factors, and that's where halotherapy comes in, dry salt therapy, because you're affecting those local growth conditions. And if those local growth conditions are thrown off, then you can potentially get pathogens like Pseudomonas can overgrow when you've got certain changes in those regional conditions.
So for a lot of people who don't have all the medical language that some people do, like yourself, what are you starting to notice? And as we discussed before, how do you see dry salt therapy impacting people that have had COVID? I know Jean's going to talk a little bit about some of the people that she's been seeing lately, but from your perspective, where are you seeing there is some possibility of how this could be utilized, as we discussed, for research as well?
Yeah, Jean and I have shared a few patients now, and the concerns are the aftermath of COVID-19. We know there's lingering fatigue and tiredness, and we're just beginning to better understand what is going on in the lung. Unfortunately, this is a disease that affects the whole body, we now know, not only the lung. The vascular system with clotting, the heart, kidney, and so on, because of the receptors that are not only found in the lung, but are also found lining the blood vessels in the heart and kidney, called those ACE2 receptors. But our concerns with patients who are recovering, if they have suboptimal lung microbiomes or lung function, they're not oxygenating well, they're going home on oxygen therapy, we find. And our hope is that perhaps with halotherapy, dry salt therapy, we can better create a more optimal growth condition in the lung to resurrect a healthy lung microbiome, get them off oxygen, get their stamina back more quickly, help prevent new secondary infection.
Yeah, great. And Jean, I know that you can pop on, Jean. I know that you were sharing some results that you were looking at as well in terms of people recovering. So what can you share a little bit more also with us, and go back and with the doctor as well?
In regards to the recovery for disease process of the COVID-19, what I'm finding is that depending on how far out they are post-recovery, they may only need just 2 or 3 sessions and their symptoms have totally resolved. Those symptoms that I've experienced specifically at that length of time post-recovery has been shortness of breath and just overall chest tightness, and they may not have both of those particular symptoms. The 2 people I'm thinking particularly about were 5 and 6 weeks post a 2-week duration of an illness. They weren't diagnosed with COVID at the time because of the testing was not available, but they tested positive for antibodies within the last probably week or 2. And they came in with these residual symptoms that they were just frustrated with. Both of them just needed 3 sessions. I had another client who had come in and she was maybe a little bit 3 to 4 weeks post-recovery, and her duration of illness was closer to more like 7 days, maybe 6 days of symptoms, not nearly as affected. And she probably stayed in the sessions only maybe about, I think we did 3 or 4 sessions. I just leave it up to them when they find that their resolution is happening of their symptoms. Then we just kind of stop, and then they can come back if they want just to continue. Both of, or all 3 of those clients have come back on a weekly basis just because they want to continue to try to heal.
Yeah, yeah, very good. And then, Jean, are you also including people in terms of, I know that your facility is now open, correct?
We actually are not opening till Wednesday, so we have a couple more days, but I do have clearance from the state to be able to do certain things at my facility, because we're more of a medical clinic than what we are a massage clinic.
Sure, sure, great. And then, Dr. Penn, I know that when we were speaking, we obviously are looking at how up in your area with Jean and others about doing some real research so that we can back it. Obviously, we have a lot of people that are on and attending this and listening to this, would love to be able to, how do we get the research on this? How can we validate this? And I know that's something that you've been working on both from a recovery and rehab perspective, but also I know that you expressed interest on this could be used as a hygiene or more of a preventative nature. So what are you showing as indications that point to that as well?
Well, Leo, we've been dialoguing as a group here just to see what the potential of this would be. We would probably propose kind of stepping into this as Jean has already done, to set up some follow-up treatment in the convalescent COVID-19 period, and setting up some metrics like some basic flow loop spirometry, measurements of pulmonary function. Quality of life becomes very important as another potential metric. So we're in the process of trying to decide what metrics would we even follow with something like this, and then looking at aligning individuals who might be interested in assisting us with any ongoing research, with a second phase of perhaps even offering this to our healthcare workers who are on the line now, in terms of being able to come in maybe once a week for a little pulmonary hygiene. And then third would be, of course, a group. We have Children's Hospital as a part of this complex, and there's always a lot of children in need, including cystic fibrosis, as well as our adults with chronic bronchiectasis, asthma, chronic obstructive pulmonary disease, and again, offering them pulmonary hygiene.
Yeah, no, that's great. I know that a lot of people are asking, right now, we don't have, quote, the science necessarily here, specifically in the United States, for protocols. So when people are talking about, and Jean, as you mentioned, how many sections should somebody come to, how frequently, and all of that. So when you start looking at the quality of life standards, or in your case, that's something that we want to get to. So for those of you that are asking questions in terms of the parameters and the length, that's part of what still is open for us to do research. I know that Mayra, who's on board, who is a respiratory specialist, a respiratory care practitioner, contracted COVID-19 and was using halotherapy throughout when she was first diagnosed and in her recovery. Mayra, are you online right now? You may, yeah.
Yes.
Yeah, so if you can share a little bit also with us about how you were utilizing a halotherapy through what you were going through as well, it'd be great.
Post-COVID, I'm using halotherapy 30 minutes every day, maybe 2 days, 5 days out of 7 of the week. The symptoms and general malaria and all sort of stuff linger after the crisis. What I call it the crisis, like from day 4 to day maybe 12. After day 12, it's been now 3.5 weeks that I'm symptoms free, but yet what lingers is the dryness of the upper respiratory system. The sinuses, the throat from the whole throat all the way to the mouth and nose. It's like the humidification system of the body is kind of shut, very dry. So what I'm doing is I'm doing my halotherapy every 30 minutes with a help. After that, I usually expectorate white clear secretion. So that is working for me. I'm also doing steam. I do 10, 15 minutes of steam. That seems to help. I believe that as a soul therapy facility owners, we need to put it out there as a complementary for maintenance, to add on for maintenance after COVID. Because after COVID, there's no doubt that your lung system have been affected. I'm not the same anymore, and I see it on my patients. As a matter of fact, I took care of 2 patients this weekend that were experiencing my same symptoms. I was blown away when they're telling me they have complete dryness of the upper nasal cavity. It's like somebody blow air at you. They feel a little bit of tightness on the throat, tickle, numbness, and they've been already off the ventilator for almost a month. One of my lady, she's still in the hospital. We're getting ready to get it out. But that's why I believe that putting it out there and offer it to the community as a complementary for maintenance, because this linger and this going to be needed. We're going to have it, I believe, a burst of people looking for help.
Great. Doctor, I have a question for you. I don't know, given this has not necessarily been studied, but some people are asking if halotherapy will help asthma in normal patients if they got infected with COVID-19. So I'm not sure what we know about how COVID-19, as you're starting to realize with the lung biome, what that effect might have on people that have asthma. Is there anything that you're seeing regarding that or other respiratory conditions?
Leo, it's too early for us to know for sure. We know that chronic lung conditions like asthma, as well as COPD, chronic bronchiectasis, have an altered lung microbiome, putting them at increased risk, and that's associated with chronic inflammation. And it's that chronic inflammation, in a sense, that is already started a fire, and then we get superimposed COVID-19, and this gets more complex. But we know there's a genetic predisposition, but there's also those with chronic medical conditions, poor metabolic health, that already have inflammation. So you're adding a lot of fuel to a fire that's already started, and those seem to be the ones, for example, with asthma, COPD, we've seen, who can advance pretty quickly and suddenly deteriorate and become hypoxic. So they're compromised because of their lung microbiome, is our feeling.
Gotcha. Jean, yes.
I guess the one thing that I think about in response to that question is my little 7-year-old guy that I've spoken to you and Dr. Penn both about. When he was 7 years old, his pulmonologist here in Omaha had told him that we gotta stop the downhill slide here. We've got to figure something out to stop the damage that he had been having all his life. He was on nebulizers, antibiotics, steroids his entire life. He was never off that because of his lung condition. And so we started doing sessions. They were maybe 10 to 20 minute sessions in the salt booth. And he would come 4 to 6 times a week, depending on his his symptoms that he was having. At the end of 1 year, he went back to see his pulmonologist, and all of his pulmonary function studies were within normal range. That had never happened to him before. He had also gone 1 full year, and this was in 2017 and 18, the winter, without having any antibiotics, any steroids, had not had any nebulizers for an entire year. So we went 1 more year, which brings us up to October of 19. And he went back in for his annual checkup. He'd gone a 2nd year now without any need for any medications. And his pulmonologist had told him that his chest x-ray looked totally normal, and he did not need to come back on an annual basis, only if he needed more help. So I think that's a bit of a testimony for what if you can create an environment that is conducive to health and healing, the body does do its best at creating healthier tissue in that way. That little guy, also to note, he probably did those regular treatments for about 18 months, maybe 3 or 4 times a week. That second year, I never saw him from once he got out of school, from May of 19 until September of 19. I never saw him once for halotherapy. And then I saw him about 2 or 3 times before he went into his appointment late October of 19. So he was able to maintain that lung health throughout that time. I just wanted to throw that out to that question.
Yeah. Well, and I know that, Dr. Penn, I know we've been talking about what are the parameters, and for a lot of people that are asking a lot of the questions with regards to how many sessions or what specifically are we going to measure? Should we use barometer readings? You mentioned, Dr. Penn, quality of life. I know we're just in the beginning stages of identifying the research model. And I know that we've been exploring both where you're located and at the university. There's some developments that have come to our attention in your area with some of the meat packing facilities, and how there seems to be a large infectious rate there. And there's a couple facilities that are looking at possibly doing some halotherapy sessions for their employees and doing some research. So while those of you that are on the call are asking questions about some of the specifics, we do have literature and a lot of other information that we'll be sending you on the conclusion of this call and throughout about this. But again, I know, Dr. Penn, these are things that we're working on starting to discover in terms of looking at what is the research. And as you and I spoke about, if I recall, we are looking at really 3 main areas. One, how does halotherapy help in the recovery of those that have been affected by COVID-19? Obviously, we have those that have been asymptomatic, and so distinguishing that versus symptomatic. But also we have it as halotherapy as a healthy respiratory hygiene, preventative nature. And I know we've been talking about that as a separate study. And as you mentioned, there are obviously quality of life aspects that people have with just respiratory conditions in general, where there already is a body of knowledge and research that exists that the Salt Therapy Association has compiled. And in a moment, I'm going to ask Cheryl and Shimon to speak a little bit about that. But Doc, is there anything else that you can see in terms of what you're seeing with the people that you're interacting with, where halotherapy may be able to play a role, and what you see as part of the next steps?
Well, I think as you reinforced, Leo, we're in the exploratory phase of all this, and certainly welcome to any suggestions anybody would have in terms of the metrics we need to be looking at. I think as Jean referred to that 7-year-old, I would look at it from the lens of a microbiologist, that she was changing the local growth conditions by clearing out obstruction. Many people don't know Nebraska stands for flat river from the Omaha tribe language. And when we know when the river is flat and you get things that dam that up, you get turbulence and you get just an overgrowth of organisms, so to speak. But the concept of you've got to clear out obstruction, keep things flowing smoothly. And by being able to do that through dry salt therapy, you're probably providing then more optimal growth conditions to help in the elimination as things are migrating in.
No, great. Yeah, I mean, clearly for those of you that are here today too, we want to be clear that we're not saying, and I don't think we can say because the research isn't there yet, can salt therapy prevent the onset of COVID-19? No, we cannot say that. Can we say that halotherapy, does anything with COVID-19? We really can't make any statements regarding that, because that specifically needs to be studied. But there are inferences, there are the anecdotal stories, there are the things that the doctor's talking about and Jean's talking about that we're working on. And we do have some languaging that we want to put out there from the Salt Therapy Association. about what are the appropriate things to be telling people. While COVID has created more awareness about our respiratory health, this is no different than before COVID-19 happened. The same things that we were talking about in terms of how dry salt therapy impacts the lung system and the respiratory system still holds true. Now we have an opportunity to actually do a lot more research with the attention that we have with physicians like Dr. Penn and Dr. Leish, who we'll be speaking with later on this week. Cheryl, is there anything that you can comment a little bit about some of the other research? I know you have come on board to expand your role at the Salt Therapy Association in some of the research. And so can you give people on this call a little bit update about what you've been working on and the direction that things are heading?
Yeah, sure. So I came on board to really start to push forward this movement in gaining better ground into research and hopefully getting some more studies to be found in the US. We have a lot of documentation from overseas, and it's fantastic and really built a good foundation. So what we're looking to do is maybe get some grant money to hold some of our own research within the the confines of Dr. Penn and other people that are on board with the understanding and the knowledge and the background of what halotherapy does, and then build on that. So again, we can't say anything specifically to COVID and halotherapy, but we can bring forth the studies that have already been done showing the efficacy with cystic fibrosis and asthma and allergies and things of that nature. So we're just looking to really bring the awareness up, bring it forward, and see if we can get some funds to come in to start more of our own research here in the States.
Thanks. Shimon, I know that there was some folks and somebody specifically that you've been speaking with. If you can also update people on one of the first measures that the Salt Therapy Association is doing and the study with the individual, he couldn't be on the call, but if you could speak to about what we're moving forward with on that front.
Okay. When you start off doing any type of research that's into this areas, you need to first start off by looking at what do we have out there and all this research that Cheryl has mentioned in various countries. So we're talking to someone who's a PhD scientist who specializes in nebulized therapeutic molecules that go into the respiratory system, which really fits into this area. And we're working with him on putting together a report that looks at whatever medical literature is out there right now on halotherapy, and then as well as looking at how does the lungs work and what happens when particles go into lungs, so that we can start to look at how salt affects that, and then start to set up the process for human studies and perhaps even how does that affect businesses and how to go about it. So always the first step when trying to put together good research on it is looking at what's out there, and then what's the proposed mechanism that the salt affects viruses and things like that. So we have been talking to someone, and we'll be bringing him on board to put these studies and the reports together.
Great, great, thanks. I know that a lot of people are asking questions specifically about salt facilities, and I kind of want to start to move in that direction right now. We'll come back looking at some of the questions. Obviously, we're in a stage right now where there are some states that are reopening. You have some places that are looking at what some new protocols are. We were on a similar web class a couple of weeks ago where we were talking about how salt rooms are going to need to manage their own smart distancing, as Dr. Penn has suggested, the social distancing in salt rooms. So we know that a lot of people are doing things to really for the safety and health of the guests and customers and patients coming in from the salt therapy. But to that regard, I want to shift it for a second, because we have somebody on here who's been on the forefront of some research, Braden, who is affiliated with the University of Alberta. I let him talk to you a little bit about, because when you start to look at the nature of salt, how does salt really impact with viruses? And he's got some interesting things to share with regards to salt, how the virus and viruses in general, when they come in contact with salt, what happens? And many of you asked about your floor salt that you have as a decor, or the salt on your walls, or salt in your salt booth. So Braden, I would love for you to just give people a little bit of a background, some of the things that you've been working on. I can show some graphs if you like. If you can speak to people here, they'd be very fascinated, as we heard a lot of stuff about how long does viruses last on surfaces. What is it that you can share about what you've been working on, please?
Sure, thanks, Leo. So first of all, I'll just tell you a little bit about what we're working on. So I'm Braden Whitlock, and I'm the research director for a company called Outbreaker Solutions. We are up here in Alberta, Canada, and we've been trying to change what the antimicrobial surface space looks like. So a few years ago, I got interested in this work. I moved over from some similar cell biology work. I was working in kind of how cancer is prevented in cells. And then I realized that infection control is extremely important. This is something that is one of the big existential risks for humanity. You know, of the things that could really hurt the human species, a serious pandemic is up there. And so we took a look at basically how infection control strategies are right now. How do they look? And of course, you can split these strategies into two streams. There's how do you control an infection once a patient is infected? And then you can also say, how do we make sure a patient doesn't get infected? So we chose the prevention stream because we thought we kind of get an amplification. If you prevent the infection in the first place, you prevent a whole bunch of bad things happening down the line. You eventually save lives, you know, save further infections and a whole lot of money. So we started studying antimicrobial surfaces and found out very quickly that they're terrible. The state of the field is very bad. People haven't put a lot of effort into this yet, and things are very understudied. So a gold standard for infection control, just to give you some perspective on the field today, would be something like this. This is an antimicrobial copper alloy. It has to be, I think, above 70% copper. And it kills bugs, a variety of bugs, both bacteria and viruses and fungus, over the course of 2+ hours. So at 2 hours, you'll start to see some serious reduction. And for some reason, that's what the field settled on as a time point. But we wanted something a lot better than that, because you can imagine where you're putting these antimicrobial surfaces. You don't have time to wait for 2 hours for something to be disinfected. So if you have an antimicrobial door handle or a stair rail or public transit stanchion or whatever you're grabbing, a lot of people are going to touch it within 2 hours. So we're trying to get down, we're bringing that time down. And bringing the kill time down is something that we were able to achieve with just regular salt, regular sodium chloride. So we started looking at when we take sodium chloride that's been seriously compressed and it becomes a ceramic-like surface, how does that act as an antimicrobial surface? And we started with bacteria. We found a very, very, very rapid reduction in bacteria. We originally reported a pilot study where in the first few minutes there was really good reduction as opposed to the 2-hour standard in the field. And right now we've got a paper coming out where we're going to be reporting that this is killing bacteria actually in the first 5 seconds to a 99.9% reduction level. So what we'll do is we'll take bacteria, put it on stainless steel and a salt surface. We work outside of the body, it's laboratory conditions, and we measure how many bacteria survive after a certain number of seconds. And in the current study we're publishing soon, it's going to be 5 seconds. And however many are left on the stainless steel is our control, and whatever the reduction compared to that is our reduction level on salt, or as we call it, antimicrobial CSC, compressed sodium chloride. And so, yeah, we're finding very, very rapid reduction. So the bacteria work was first. We were curious about fungus and, of course, about viruses. So we did some fungal work and found, again, similar results in the first minute, very rapid reduction. And from 2017 onwards, there's been some decent study about salt and viruses. So we didn't really know exactly the mechanism. How does salt destroy a pathogen? in 2017, we learned something very important, and some follow-up studies are starting to clarify what's going on here. So we can think of salt's effect on pathogens, and it doesn't really matter what kind of pathogen, it seems like at this point. We can look at it from two angles. One angle is slowing the growth and replication of a pathogen. So in the case of a bacterium, making it a bad environment for it to grow and proliferate. In the case of a virus, it would be whatever its host is. And then there's the other method, which is just physical destruction. So don't worry about slowing anything down. Make sure everything's dead, and then of course they can't reproduce. They can't be infectious. So in 2017, a paper came out from a lab actually just a couple doors down from ours. There are 3 salt labs here in Edmonton, Alberta. And the mechanism that they observed in the first 5 minutes against influenza viruses was a very minuscule dissolution of salt in the droplet that contained the virus. So viruses are floating around. They're very rarely floating around in a completely dry state. Usually they're in some kind of droplet, have a small liquid coating. They're usually wet. And when they land on a salt surface, a tiny, tiny, tiny amount of that salt is dissolved. And as it dries, it recrystallizes with a sharp shredding effect that physically destroys the virus. Now, influenza being an enveloped virus, it has its inner protein wall, and then it has some fatty coating on the outside of it. Now, we know that enveloped viruses are historically, classically, more susceptible to disinfectants because this fatty coating is fairly easy to disrupt. You can do it with just regular old hand soap. And once it's disrupted, the virus loses its infection ability because a lot of what it needs is going on in that surface that you're disrupting. Now, fortunately, the current coronaviruses generally, also similarly enveloped viruses, we expect that it should have the same effect on that it did on influenza. And that's some of the work that's ongoing now. So we've partnered up with the University of Alberta here. So we have a private lab where we do a lot of bacteria work. And then we partnered with the University of Alberta to test what happens when you take coronavirus, put it on our surface, and then expose it to cells that it should be able to infect. What happens to those cells after it's been on a surface like this? It's underway now. We're going to be reporting it as soon as we can. And we have a couple of other bits of information about how salt is affecting viruses. We have to be careful about how we think about this because in this question, you have to be asking, are we talking about inside the body or outside the body? Because if we're talking about inside the body, the rules change a little bit. You're not going to ever fully dry out something inside the body. Now, salt is still going to have its osmotic pressure effect. It's still going to draw moisture toward it. It will always do that. Water will follow and moisture will follow salt. But it's not going to be able to dry and fully recrystallize in a shredding effect. So it's not going to be the same destructive effect inside the body. I'm saying this speculatively. There is nothing clearly looking at that, but it just doesn't make sense that would be possible in an area that can't fully dry out. So then you have to look at this other angle of how salt interacts with pathogens, and that is changing how the surface of a virus, let's say, can interact with its surroundings. So there's a little bit of literature, again, around the same time, 2017-ish, about what happens when you change the environment around a virus. What happens to its infectiveness? People would take some viruses and put them on some kind of inert surface and watch what happens over time if they put it in a solution with a lot of protein, or if they put it in a solution with a lot of salt. They would change things around like that. And there's quite a lot of impact on the infectivity of a virus based on what kind of environment it's in. So that's what I imagine is probably fairly relevant to inhaled sodium chloride. It's more, not so much the recrystallization. But for outside of the body, we know that sodium chloride is one of the, if not the fastest antimicrobial surface known today, regardless of whether you're talking about bacteria, fungus, or viruses. So I hope that's a decent overview. I'm happy to answer more specific questions if there are any.
No, I appreciate that, Braden. I know a lot of people that are here today listening to this, you know, one of the initial early on questions, and Shimon, you're going to want to probably chime in here as well, is a lot of people have salt as a decor element in their salt rooms. And people have salt, for example, on their floors. People have salt bricks on their walls. And so in looking at cleaning, right, and cleaning salt, one of the things, because of the studies that you're talking about, we've recently showcased some of that with the surgical masks that were being lined with the sodium chloride particles, the other study that you're talking about a few doors down from you. But right now we're kind of making that leap that based on some of the evidence that you're saying, that if somebody is in a salt room, and whether they're asymptomatic or not, or whatever whatever may be in their quote respiratory droplets, it seems to be indicating that in a relatively short period of time, that virus is going to die. Is that what you're saying?
Yeah, salt being used as even a quarantine room, something that really needs to stay clean, is something we're looking at very closely right now. It looks like if you have salt fixtures, whether they are mined, something cut from a block like a Himalayan salt, whether it's a compressed salt, or whether it's just loose granulated salts, it doesn't seem to matter too much. The speed changes a little bit, but ultimately it works very quickly. When something lands on a surface outside of the body, you can be pretty sure it's going to die within, let's say, under a minute, I think would be a safe estimate. If it's a particularly hardy virus, not an enveloped one, there's actually no information on that, or almost no information on that. So that's work that we're doing right now as well. What happens if something like norovirus or the gut viruses that cause diarrhea, those kind of viruses, what happens if one of those lands on the surface is the only category of pathogen that we don't really know yet. So we'll report that as soon as we know too. But for enveloped viruses, fungus, bacteria, probably a very fast reduction. We haven't found anything that is not reduced very quickly yet.
No, great. Great, and I really appreciate that. Shimon, so with a lot of people that have salt rooms or salt booths and such, and people are asking questions about, somebody could be asymptomatic going into a salt booth, and, they're in a salt, booth breathing, or they're in a salt room. What is some of the protocols of, should there be anything different that people are doing? Or what are we suggesting here?
Well, keep in mind that a lot of what Braden is talking about is with regards to surfaces. So viruses landing on salt surfaces, and salt booths and other salt rooms where you have chairs or the wood from the walls, you should still clean them or disinfect them as normal, because the virus will be landing on the wood and not on the salt. With regards to salt on the floor, it does seem that the studies and the research that he's been doing does indicate that the salt will handle those viruses.
Yeah. Well, and then the other thing too, a lot of people are, so basically if somebody's in a salt booth or salt room, they should still follow the same protocols with taking their disinfectant, rubbing their surfaces all over, and doing the same thing. Right?
Yeah, so when disinfecting surfaces, always follow the CDC's guideline, and they have specific disinfectants. It's pretty much any disinfectant will handle it or close to that. So always, don't rely just because there's salt in there that you don't have to clean your booth. You do want to clean it. But it does help a lot with surfaces that are salt surfaces that you can't really use a water-based solution on to clean it. This research does help.
Yeah, and I know some people have asked about UV lights in general. So can you just comment a little bit from the technical side about what's going on with people, based on what we're hearing, UV light may not provide any more protection as long as if you're just cleaning the surfaces with disinfectant.
Right. So UV, and specifically, like you said, UVC does kill viruses. It does have to be a specific wavelength that's considered the UVC, which is, as we mentioned in our previous call, it's very dangerous for human exposure. When using it, people are using it, I see, in two different ways. One is upper ear disinfection. They're shining it above people's heads, basically, and to kill viruses suspended in the air above people's heads where it's not exposed to people. The other way is I've seen a lot of products being advertised that they're advertising UVC wands or lights for people to go around and expose surfaces to. In order for that to work in a salt room, you would have to expose it to a specific length of time and from a specific distance. And the surfaces do have to be clean, because if you're shining it on a surface that's covered in a layer of salt, the UVC won't reach the actual surface you're trying to disinfect. So when doing that, regardless of course, the health concerns and figuring out how to protect yourself while you're walking around with this UVC light, you still have to clean salt off your surfaces in order to use it to disinfect surfaces. So I would suggest just using the CDC approved disinfectants and cleaning the surfaces just standard instead of cleaning it and then also going over it with UVC.
Yeah, very cool. Thanks. Yeah, I just wanted to share a screen real quickly here with you folks. This is part of the study that Braden was talking about, where you have how quickly compressed sodium chloride is killing off the viruses. So for a lot of people, when you were hearing throughout this pandemic about how long things last on surfaces like your packages and everything else, obviously with sodium chloride it's completely different. So we're going to be taking some of this information that Braden has and kind of communicating it out from the Salt Therapy Association and to various facility people, members, so that people can be informed and better educated about how this, how you can language about salt. Because you do have a lot of people coming into these salt rooms now, where for many facilities that are starting to open up, they're taking protective measures. They're scheduling their salt rooms sporadically in their days. They're creating more distancing. Some facilities are only allowing individual treatments or people that are grouped together with known family members. So this is all new territory for a lot of people, but taking these precautions is part of what we're talking about. And people are going to be questioning this. So with regards to the Himalayan salt that people have as a decor element, based on some of the current research, that's somewhat already, does not necessarily need to be cleaned, as Braden and Shimon were alluding to. So there's some information around that. Likewise, and I think Dr. Penn would understand this, and it may make sense with what Braden is saying, that if somebody is having a respiratory droplets out into the air, in a salt room, Braden, as we talked, the halo generators are dispersing very small micron-sized salt particles in the air that can attract those airborne respiratory droplets. And in so doing, it would seem to make sense that the same slightly absorbing and recrystallization would occur in capturing those droplets in the air as well. So,
did you want me to comment on if I think that's feasible? That seems reasonable. We don't have data on it, and I wonder to myself if, you know, if you're in an environment with a lot of airflow, this might be something to take very, very seriously. Otherwise, droplets fall fairly quickly. We're probably not appreciating just how quickly droplets go away in a typical environment. We have stats on, you know, how many infections are spread via hands and how many via aerosolized things. Unless you're rigorously aerosolizing something, that's probably not your biggest worry, what's floating around in the air and the salt, you know, trying to attract it. However, that really does seem quite feasible based on the mechanisms we know about how salt physically destroys things. And I'd actually really like to test that. That'd be easy to test.
Yeah, very good. Very good. Let me just turn to, I know we're kind of coming up here on time. I wanted to get to some of the questions that we have here that people have posted. Some of them I think we can answer. So one of them was, can halotherapy or sodium chloride kill the COVID-19 virus? I don't think, to what Braden mentioned, we can claim that it can kill it as of yet. We're waiting for the new research to come out, which is going to be relatively soon. Again, we want to make clear the distinction. That is not that we're not saying that halotherapy is going to kill the COVID-19 virus, but from a surface point of perspective, like the other viruses and strains of bacteria that they've tested, that's going to be a statement that they'll be able to make soon out of the research. Somebody's asking, are there recommendations on content for COVID-19 specific screening form? I know, Cheryl, this is something that you were starting to look at. I know that we were looking at what people can ask or not ask, or if they should be asking. So as people are reopening and people wanting to go to salt therapy facilities, you know, what is that protocol? Are people asking people, you know, have they traveled? Can they ask questions of, have they contracted it? Are they, you know, what's the stages? Are we any further yet with being able to identify that specifically?
So I'm combing through the CDC website, which is challenging. There's a lot of information. And basically what I'm finding from a business standpoint is follow the CDC protocols that we all know for disinfectant and social distancing and whatnot. What I'm not finding specifics on are exactly the procedure with a business owner and someone coming in to use their services. Can you screen for COVID, asking questions? Do you have the right to take their temperature? I mean, this is a very gray area. We haven't experienced this before. We're kind of rewriting history, so to speak. So at this point in time, because most of the salt therapy businesses are privately owned, you do have the right, if someone comes in and they seem to be presenting with some symptoms, coughing, sneezing, those type of things, and you choose not to let them in your facility, that is under your prerogative. Under the law, you do have that right to tell that client to come back on another day. So from the CDC, they're saying follow their protocol. The next step is looking into your government and your local guidelines for opening. I'm up in New York State, and so we're not able to open for quite some time. You know, under the protocol of who is opening first and what phases, we have to wait. So I think it's going to roll out with more information once they start to go into the phases of who can open, and we'll have a little bit more information there. I looked deeper into HIPAA regulations and things like that, and collecting information from a business owner standpoint, saying that your employees, if you want them tested for their temperature prior to them coming into work and things like that, you are covered in asking and doing those things. But from a business out to the public, I'm not sure. I haven't exactly found that wording yet.
Yeah, no, thanks. And I know that we're doing some more of that, and that's going to vary. But keep in mind too, taking temperature, someone may not, and correct me if I'm wrong, with the doctor online too. I mean, taking somebody's temperature, they could be normal, but they could still be asymptomatic. So exactly. taking temperature may not be the indicator for anything anyways, right? Exactly.
They could be totally asymptomatic. So, you know, that could be for your employee as well as people coming in.
Yeah. And you had some people asking, there was a, you know, should somebody be wearing a mask doing a salt therapy treatment? Well, if you're wearing a mask, you're not going to be able to get the inhalation in. So we're going to say, no, you don't wear a mask inside of a salt room. In terms of limiting the salt room to a guest, again, you want to do whatever you can to maintain social distancing. Obviously, you're going to have people coming back to facilities that are eager and they're wanting you to open. I know here in South Florida that there's been approval in some areas where they are being deemed like a retail business. And so they're able to open up similar to other retail businesses of being open for 25% occupancy. So I think people need to be really looking to their local governments and the CDC, as Cheryl said, about what to do. I know, Gene, you're in a different situation because your facility is more of a medical facility and you have licensed medical professionals. So how are you guys dealing with it, and as you're reopening now?
Our guidelines have been set by our state as well for the Department of Health, and they are recommending that we go ahead and ask questions. We aren't asking specifically COVID-19, have you been exposed or had the disease, but what we're asking is symptomatic type questions. They encourage us to use, to check their temperatures. However, in my facility, I'm foregoing checking the temperature because I don't think there's that much relevance as far as focusing on if they're having any symptoms.
And are you wearing masks in your facility when people are coming in?
We are required by the state for both parties to be wearing masks, both the therapists and as well as the clients.
Yep, and very good. Great. So we have just a couple more minutes here. I know there's a bunch of other questions that we'll get to in some of the reporting. Dr. Penn, I know you've been on the whole time. I appreciate you're gracious with your time. You're still on mute, but if you can, anything other that you'd like to, based on what you're hearing, any more information or some ideas about what you're now thinking about?
Thanks, Leo. I would reinforce, when you're opening up as a business, work with your local health department. This is a big gray area now in terms of how long you're infectious and infectivity, and there's various guidelines out there. But this was helpful for me. What I would like to see, once you prepared kind of this exhaustive review of the literature in terms of the underlying immunopathogenesis of how salt therapy may interact with the COVID-19 or the SARS-CoV-2 virus as kind of a foundation of how to proceed ahead in terms of setting up some type of research that would add value to this whole area. And also, always think in terms of safety to our healthcare workers, but also how we can optimize recovery from really a devastating infection. It's got so many faces, as we've learned, and anything we can do to help people in the recovery phase would I think they would greatly appreciate.
Yep, great. No, I appreciate it. And I know we're running up onto time for everybody. There's a lot more questions. We've copied these questions. We're gonna get some papers out regarding this so that we can inform everybody and summarize this information and make it more useful. So I wanna thank you, Dr. Penn. I wanna thank you, Braden, Cheryl, Mayra, Adam, Shimon, and Gene. Thank you all so much. Everyone has been commenting how informative this is. Obviously, this is just 1 hour. There's so much topically that we could be talking about. So stay tuned for some additions that we'll be doing on Salt Ed and further literature that we'll be publishing and sending out to your way. So thank everybody. Have a great rest of the day, and please stay safe and be healthy.